of the domains I've done a fair bit of work on for about the last 6 or 7 years has been the transition from child to adult mental health care services. And that's an area of the system that we know is notoriously difficult for people to navigate, not just in Canada and Ontario, but internationally as well. And of course, traditionally we think of adulthood starting around age 16 or 18. And so many of these services end at that particular age range. And yet the literature tells us that there's something in between child services and adult services. If we think of the median adult patient maybe being in their 50s and the median child patient maybe, I don't know, 8 to 10 years old, youth that are in the 16 to 25 or beyond 30-year-old age, we now think of as emerging adulthood. And what they need is often quite different than what either children need or middle-aged adults need. One of the approaches to addressing this issue that we wanted to try out in our research team was an approach called experience-based co-design. It's a type of co-production approach, or an element in a co-production approach, where the people receiving services are co-producing services with the people delivering them. And co-design, experience-based co-design, is one element of such an approach where we bring people together to talk about their experiences, what some of the challenges were, what some of the great things were, and then and we do that from all of the 3 perspectives I mentioned. So the young person themselves who's involved in receiving services, the family or caregiver of that person, and service providers together. And we look at each sets of experiences for each of those groups in terms of what worked well and what didn't. We bring them together in their own groups to kind of understand each other, share perspectives, do what's called an experience map, where we take the touch points in each of their experiences. And by a touch point, we mean those moments that are so memorable that when they go back to talk about experiences, it's what they'll come back to again and again. Once we've identified touch points based on individual interviews, we'll bring people together in focus groups by perspective. So we'll bring all the young people together, we'll bring all the family members together, and we'll bring all the service providers together. And in doing so, we feed the touch points that we identified in the data back to them and say, did we get it right? So it's a validity check, but it's also a ranking exercise where they tell us what's most important to them for us to work on. And why that's important is it means that they start to develop a common view of their experiences. So they might have felt very isolated and alone in an experience initially. Now they start to tell us, wow, I'm not the only one, so-and-so went through that too. So there's something that happens there where they start to feel much more empowered, that I'm not just speaking about my own experience, we have a shared experience. And it's important that people start to hear about this experience. Whereas I might have thought I was kind of an outlier and not that important, I'm not alone in this, and people need to hear it. And the co-design process is obviously a facilitated approach. There's many steps to it. I won't go through all the details of it, but we walk people through a deliberative process. We have traditionally started with each group doing a co-design around one of the touch points that was most meaningful for them separately. Again, this creates that sense of group and empowerment among each group initially. As they're going through these processes they've never done before. Many people have never been told, guess what, you're a designer. You're going to design solutions now. And so that can be a little bit intimidating. So having them do it together builds a lot of, again, commonality from each perspective. Then what we do is, when we're not in an online environment, we have people physically in different rooms, we switch rooms. And we have one person stay back and share the design that they came up with to the next group. And the next group is instructed that they can only enhance what's been done, not tear it apart, not start all over, but build on it and layer on it their perspective. And then we switch rooms again, and the third group will come in. So by the end, we've had 3 completely co-designed prototypes by perspective initially, and then layered on. We then share in group, And that's an amazing experience. And often it's at this point when we bring everyone back together after that first round of co-designing kind of in turn, that we first see these moments of harmony. They call it transcendent unity, where suddenly everybody stepped outside of their positionality and we're all working towards a common solution and really developing respect for each other. And now we're waiting to see where does that take us in the long run. COVID has hit. We're now organizing new ways through Ontario Health Teams. LINs are being dismantled. So we're not entirely sure where it's all going to go, but I can certainly say that what we're finding is this is a really promising approach for bringing people together in the mental health space. And we're increasingly applying that approach to other vulnerable populations. And that's starting to become a big thing at McMaster. We've had approval, my colleagues and I, led by Sandra Mall and Michelle Phoenix, to create a co-design hub for vulnerable populations at McMaster. And so we're trying to take the lessons that not just my team, but other teams at McMaster doing similar work in co-design out to the community and learn from the community, share lessons learned across campus and so on. So that's going forward. And also we're studying not just sort of these kind of one-off system improvements through co-design, but a more ongoing co-production approach to improving services, not just in health, but beyond health for other vulnerable populations. We have some SSHRC funding for an international case study that we're working on right now in that area as well.